Good afternoon, everyone. My name is Maria Bavetta, and I'm here today to talk to you about perinatal mental health. I'm here, I've been a member of NSUN and the National Involvement Partnership. I've set up my own mental health charity, and I'm a recovered service user. But the hat I'm talking to you today is about the Maternal Mental Health Alliance. Now, this is a coalition of over 70 UK national organisations that are committed in improving the well-being of mothers and their children. So I want to talk to you about Anna. Now, Anna is a mum who has a 5-month-old baby. She had the baby blues on day 3, and she hasn't been able to shift that anxiety to the point where she's struggling to come out of the house. She eventually got to the house and got to the GP, but actually all that happened is she was prescribed antidepressants. She's really struggling, actually. Go back. She's really struggling. She's crying all the time. She's worried if she tells anyone her thoughts, her child is going to be taken away from her. Because actually, we all have intrusive thoughts, but someone, particularly a mum who's had, for example, perinatal OCD, is going to attach meaning that isn't necessary to those thoughts. So we fast forward, and her little boy, who's now 8 months, called Nicholas, he's not getting attention from his mummy. She's now got severe perinatal OCD, and she needs to be admitted into a mother and baby unit. She doesn't know where to go, and she's really struggling. So this is where I come in as part of a team of people called Everyone's Business, and it's a campaign looking at improving perinatal specialist mental health services. There are 3 main aims. There has to be accountability at national level for these inpatient mother and baby units, because actually a mum who's poorly needs to stay with her baby. She cannot be separated. There needs to be community specialist perinatal mental health training in every area of the UK, and it needs to be in line with national guidance. And NICE delivered the national guidance in December on antenatal and postnatal mental health, and that's what should be adhered to. And there needs to be compulsory training for all health and social care professionals that work with women of a reproductive age. So if I show you this map, this is a map of all the MBUs in the UK, and we're 60 beds short. That's not 60 mums, that's hundreds of mums because of the turnover. And if we look at the next map, this is a mapping exercise looking at the specialist perinatal mental health services across the UK. We've got some green areas, which is great, because that's where we have excellent services, but look how small an amount they are. The main colour is red, and that's because there's nearly over 50% of the UK that doesn't have any services for mothers who need specialist perinatal mental health care, and that's the reality. And actually, if we think about the costs, it's in a year's worth of births in the UK, it's £8.1 billion as a long-term social and economic cost, and that's how it's split. And in fact, the breakdown is 28% for the mother, 72% for the child. Sorry, I keep touching you because you have to turn my side. And if we go to the next one, now if the cost is 8.1 billion, if you look at those tiny green numbers, 337 million is the small cost of actually taking action. So let's put this challenge in perspective. Okay, UK maternity care is £2,800 per woman, £67 a woman for specialist perinatal mental health care. 2.6 billion is the total NHS maternity budget. You can see where I'm going with all these statistics. £482 is for the care of the cost of maternity negligence care. Those 60 beds that I mentioned, which is hundreds and hundreds of women, 0.00023% of maternity costs. So the cost of staying where we are, 8.1 billion. The cost of actually moving forward, so if we go to the last slide, is that okay? I just want to say there is good news, just to finish as Andy had. There is good news because we know how to treat these women, and that's really great. But actually, we need to look at using that money a lot better. Let's look after our mums, and I'm here in the tea break if you want to have a further chat.